Caring for your biliary tube after placement is important to keep it functioning properly and to prevent infections. This video will explain what you need to do to take care of your biliary tube after your procedure. Your biliary tube is a thin, hollow, flexible tube with several small holes along the sides. The biliary tube helps bile flow from the liver into the intestine when the bile duct is blocked. Depending on the type of biliary tube you have, it may be connected to a drainage bag outside of your body. You cannot drive right after the tube is placed because of the medications you receive during your procedure. A responsible adult must drive you home when you are discharged. You may drive the day after your procedure unless your doctor tells you not to. You may go back to your normal diet after the procedure. You should replace the fluids that are lost through your drainage bag by drinking equal amounts of electrolyte-enriched sports drinks such as Gatorade. Drink at least 6 to 8 glasses of fluid a day while your tube is in place. Ask your doctor for recommendations on how you should replace your fluids if you have questions or concerns. Get plenty of rest after the procedure. A responsible adult should stay with you the first night after your procedure. Avoid lying or sleeping on the same side as the tube to keep it from twisting. You may go back to your normal activities 24 hours after your procedure. Do not lift anything heavier than 10 pounds unless you are told otherwise. Keep taking all of your prescribed medicines after the procedure unless your doctor tells you otherwise. You may shower 48 hours after your procedure, but do not swim or soak in water while your tube is in place. Please take your dressing off before entering the shower. Keep the dressing over the tube site clean and dry. You may have a stitch holding your tube in place. If the stitch breaks, tape the tube to your skin and call the interventional radiology department at the number in your handout. Your tube may have a lock that holds it in place from the inside. Do not open the lock. Your dressing should be changed every other day. It should be changed sooner if it falls off or becomes wet or soiled, or unless you are told otherwise. It may be easier to change to the dressing if someone helps you. Always keep the bag below the tube site to allow it to drain properly. Make sure the tube remains in the proper position, does not become twisted, and that the holes in the tube do not become blocked. Always keep the drainage bag attached to your clothing with a safety pin or with the elastic band that is located in the package insert of the drainage bag. This elastic band weaves through the 2 holes at the top of your drainage bag and can be worn around your waist or abdomen. Do not let your drainage bag hang off your body, as this creates tension on the suture, which can cause the accidental removal of your tube. Here's what you need to change your tube dressing. 4 gauze dressings, tape, scissors, mild liquid soap and water to wash around the tube, such as antimicrobial unscented soap like Dial or Cetaphil, paper towels, soap or hand sanitizer to wash your hands. Make sure you have a clean surface for your supplies. Wash your hands or use hand sanitizer. Tear 4 strips of tape in the size you need to cover the dressing. To make the tape easier to work with, hang the strips off the edge of the clean surface and keep them close by. Take 1 gauze dressing and cut a slit from the folded edge to the center of the gauze. If you're having discomfort at the insertion site, you can take another gauze dressing, roll it into the shape of a log. To prevent the dressing from unrolling, wrap a piece of tape around it. Remove and throw away the old dressing. Be careful not to pull on the tube or your skin. Inspect the insertion site for signs of leakage, redness, drainage, foul odor, or swelling. Wash your hands or use hand sanitizer again. Gently wash around the tube with mild soap and water and pat dry. Be sure to remove all drainage to prevent irritation and protect your skin. Carefully place the dressing roll under the tube. This will help with discomfort and keep the tube from twisting at the insertion site. To apply the new dressing, take the pre-cut gauze dressing and gently slide it around the tube. Cover the pre-cut gauze dressing, roll, and tube with the remaining 2 gauze dressings. Secure the dressings with tape. Do not tape the tube directly on the skin. You will need to flush your tube before you apply the new dressing. Bile tends to be a thick fluid, so gentle flushing is needed for proper drainage. It is important that the holes in the tube do not become blocked. Your caregivers will tell you how often you should flush your tube. To flush your tube, you will need a pre-filled 10 ml sodium chloride syringe and alcohol pads. If your tube is capped, not attached to the bag, begin by wiping the end of the cap with an alcohol pad. Take the white cap off the pre-filled sodium chloride syringe. Twist the syringe onto the end of the cap. Slowly push the contents of the syringe into the drain. The fluid should enter the tube easily when gentle pressure is applied to the syringe. Remove the syringe by twisting it off the end of the tube. Throw the syringe away. Do not use it again. Change the cap on the end of the tube every week. If your tube is attached to a drainage bag, begin by untwisting and removing the drainage bag from the tube. Hold the tube up and keep the bile from leaking out of the tube. You may find it easier to place the end of the drainage bag that you just untwisted on a piece of clean gauze to prevent contamination while you flush the tube. Wipe the end of the tube with an alcohol pad. Take the white cap off the pre-filled sodium chloride syringe. Twist the syringe onto the end of the tube. Slowly push the contents of the syringe into the drain. The fluid should enter the tube easily when gentle pressure is applied to the syringe. Remove the syringe by twisting it off the end of the tube. Using a new alcohol pad, wipe the ends of the tube and drainage bag and reattach. Throw away the syringe. Do not use it again. Before reattaching the drainage bag to the tube, you will want to empty the bag. You may not have to record the drainage amount from the bag. However, if your doctor tells you to record the drainage amount, hold the bag at eye level. Record the amount and the date and empty the drainage bag into the toilet. Clean only the outside of the tubing and bag with warm, soapy water and rinse it thoroughly. Change the drainage bag every month. If you have any discomfort during flushing, you might be flushing too rapidly. Slow the flushing. If the pain continues, stop flushing and call the interventional radiology department at the number in your handout. Watch for the following signs and symptoms: redness, drainage, foul odor or swelling on the skin around the tube site, abdominal pain, nausea or vomiting, a change in the color of your stool to a very light or grayish white, shaking chills, a temperature above 100.4 degrees Fahrenheit or 38 degrees Celsius, a yellowing of the skin and eyes, and very dark urine. If you have any of these signs or symptoms, follow these steps. If the tube is capped, uncap it and attach it to a drainage bag. Be sure the drainage bag is below the level of the tube site. If your tube is already attached to a drainage bag, remove your dressing and check to see if the tube is twisted. If the tube is twisted, straighten it until the fluid begins to flow. If fluid does not drain after removing the twist in the tube, you may need to gently flush the tube. If these steps do not relieve the signs and symptoms, call your doctor or go to the nearest emergency department. Your tube needs to be changed regularly to reduce the risk of infection and to make sure it's draining properly. If you do not have a follow-up visit scheduled, please call 216-444-6640. Please allow 10 business days from the day of your tube placement. If you have any questions at any time, please ask one of your caregivers. Thank you for choosing Cleveland Clinic for your care.